Trying to conceive can be an exciting time filled with anticipation. Many women eagerly await the first sign of pregnancy, but deciphering these early signs can sometimes be confusing. One such sign that often raises questions is implantation bleeding. This light bleeding can be mistaken for a period, leading to uncertainty about whether or not pregnancy has occurred. Understanding the difference between implantation bleeding and a regular period is crucial. It empowers them to interpret their body's signals accurately. This knowledge can alleviate anxiety and provide clarity.
Implantation bleeding is a common occurrence in early pregnancy. It happens when a fertilized egg, known as a blastocyst, attaches itself to the lining of the uterus. This process can cause some light spotting or bleeding. Typically, implantation bleeding occurs about 6 to 12 days after ovulation, which is around the time your period is due. This timing often leads to confusion, as it can easily be mistaken for a light period. However, there are distinct differences between the two. Understanding this natural process can help alleviate any concerns and provide reassurance during the early stages of pregnancy. Remember, implantation bleeding is usually a positive sign, indicating that the embryo has successfully implanted in the uterus. However, it's important to note that not all women experience implantation bleeding. In fact, it only occurs in about 20 to 30% of pregnancies. Recognizing the subtle differences between implantation bleeding and a regular period is key to understanding what your body is telling you. While both involve vaginal bleeding, they have distinct characteristics. Firstly, implantation bleeding is typically much lighter than a regular period. It usually presents as light spotting or a few drops of blood, rather than the heavier flow experienced during menstruation. The color of the blood is also different. Implantation bleeding tends to be light pink or brownish, whereas menstrual blood is usually bright or dark red. Secondly, implantation bleeding is short-lived, typically lasting only a few hours or up to 3 days. In contrast, a regular period can last for several days. The flow of implantation bleeding is also consistent, unlike menstrual bleeding, which may fluctuate in heaviness. Lastly, implantation bleeding is usually painless or associated with mild cramping, unlike menstrual cramps, which can be more intense. These differences in color, duration, flow, and accompanying symptoms can help you differentiate between implantation bleeding and a regular period. Section 4. Early signs of pregnancy. Beyond implantation bleeding. Implantation bleeding is an early sign, but not the only one. Your body undergoes many changes during early pregnancy. A missed period is a clear early symptom. Breast changes are also common. Hormonal shifts can make breasts tender or swollen. Nausea or morning sickness can occur anytime. Fatigue is another hallmark of early pregnancy. Section 5. Other possibilities in confirming pregnancy. While the symptoms discussed above can be indicative of pregnancy, it's important to remember that they can also be caused by other factors. Stress, hormonal changes, lifestyle factors, and certain medical conditions can mimic pregnancy symptoms. Therefore, it's crucial not to rely solely on these symptoms for confirmation. If you suspect you might be pregnant, the most reliable way to confirm your suspicions is to take a pregnancy test. Home pregnancy tests are readily available over the counter and can detect the presence of the pregnancy hormone, human chorionic gonadotropin, or HCG, in your urine. For the most accurate results, it's recommended to wait until after you've missed your period to take a pregnancy test. This is because HCG levels continue to rise in early pregnancy, making it easier for tests to detect. If your pregnancy test comes back positive, it's essential to schedule an appointment with your healthcare provider. They can confirm your pregnancy through a blood test and provide you with personalized advice and prenatal care. Section 6. Taking the next steps, tests, and consultations. Navigating early pregnancy can be exciting and overwhelming. Taking a pregnancy test is a good first step if you suspect you're pregnant. Home pregnancy tests are convenient but not foolproof. Consulting your doctor is crucial for confirming pregnancy and discussing next steps. A blood test by your doctor is more sensitive than a urine test. Your doctor will guide you through prenatal care, vitamins, and lifestyle modifications. Early and regular prenatal care ensures a healthy pregnancy and safe delivery. Thank you for watching. Don't forget to like, subscribe, and comment. If you have any questions, type them below.